All right, we've got another minute here. We'll give the other folks another minute. We'll start with this one. This is a recent article, 2019, in the journal Traffic Injury Prevention, and it's titled "Automotive Injury Trends in Contemporary Fleet, Belted Occupants and Frontal Collisions." The vast majority of literature is in rear impact collisions. So this is a sort of a odd bird, but it's a really good odd bird. Talk about some very good concepts that you need to put into everyday practice. All right. So these researchers are out of the University of Virginia, and the study included occupants between 13 and 97 years of age, with a mean age of 32 years, half men, half women, who were involved in a crash with a principal direction of force between 10 and 2 o'clock, head-on collisions, and restrained by a 3-point belt. Pregnant occupants past their first trimester, ejected occupants in crashes involving any rollover were excluded. Additional variables in the assessment were delta V, which is your change in velocity, sex, age, height, body mass index, and vehicle model year. Serious or fatal injuries are assessed using the abbreviated injury scale. Now, Mary, you familiar with that one? The AIS scale?
Yeah, a little bit.
All right, so this it's basically a six segmented assessment scale. It starts from 1, which is minor, 2 is moderate, 3 is serious, 4 is severe, 5 is critical, and 6 is maximal untreatable. Probably AKA dead. All right, some key points here. Automobile safety has experienced substantial changes since the late 1980s and early 1990s. Newer vehicles are associated with lower crash-related mortality related to pre-1994 vehicles, mainly because they keep you in the vehicle better, and airbags. Airbags change injuries. You still get injured with an airbag, but
Yep.
kind of injuries. Analysis from 2013 now found that more recent model years are associated with reduced risk of serious injury for all crash types. Results. Number of frontal crashes, 22,854. Total number of occupants assessed, 31,254. There are a total of 18,441 people sustained a total of 69,404 injuries, approximately 3.8 injuries per injured occupant. So this is that's a good number for us, because it's very important when you especially do those initial intakes, you ask about the whole body. You know, typically when we see a patient, we focus on the most important area for a regular patient, but for a car accident patient, you got to deal with all of them. You got to deal with the neck, the low back, the hands, wrists, ribs, whatever. You got to bring them all out. Arm, forearm, hand, and wrist injuries remain steady in prevalence. Skeletal thoracic injuries and arm, forearm injuries were the amongst common injury types. The prevalence of skeletal thoracic injury increased significantly from the younger to the older age group, occurring almost 3 times as often as any other injury type in the older cohort. Among older occupants with skeletal thoracic injuries, nearly half were in the seating location other than the driver's seat. All right, so that's just 2 good pearls there for us. Number 1, the older the more you get injured, all right? And then nearly half were in the seating location other than the driver's seat. So I think part of that is going to be the driver's going to be more aware of the collision. That's a big advantage the driver has most of the time, not always. Sometimes I had a recent crash in, young man was sitting in the back seat with his head down on his phone, they got rear-ended. So that's a bad position. He didn't see him coming, he was unaware, he got rear-ended, and that is a very common finding. Newer model year vehicles, 2009 and later, generally carry less risk of injury in frontal collisions with belted occupants compared to older model year vehicles. The greatest reductions can be observed in skull fracture, knee, thigh, hip injuries, including knee injuries specifically, and ankle injuries. Statistically significant reductions were also observed in cervical spine injury, abdominal injury, and rib fracture injury. So remember, this is front impacts. It's actually the opposite in the rear impact. In the rear impact, you can see more cervical spine injury because of the fact is the bumpers are stiffer. Statistically significant reductions were not observed for sternum fracture or rib fractures. Now, the caveat with that is these things are hard to find. The x-rays are really difficult to see fractures in this area, so many times you got to use what's called a bone scan, where they do the radioactive glucose in there, and they can see where the fractures are. I had one in the lumbar spine. It really didn't show up well, and we did the bone scan. It showed up like, you know, a Christmas tree light. Abdominal and lumbar spine injuries continue to occur with similar frequency compared to other injury types in newer model year vehicles. The most common musculoskeletal injury types in the vehicles of model year 2009 and later were injuries to skeletal thorax, ribs and sternum, arm, and hand and wrist in that order. Improvements in thoracic injury protection have lagged behind other body regions. Females are at greater risk of injury compared to males even after controlling for delta V, age, height, BMI, and vehicle model year. And then another really key point. It has been reported that female drivers have a higher rate of injurious crashes per million miles traveled when compared to males. The odds of a belt-restrained female driver sustaining serious injuries is 47% higher than that of belt-restrained male driver when both were involved in comparable crashes. The authors suggest that sex itself has an effect on injury tolerance. They conclude that the possibility of bone mineral density being different and differences in bone and ligament material properties are going to cause more injury. Now, the other factor to look at is just the diameter, neck diameter, right, or body diameter for that matter. Brain injuries, concussions exhibit a trend toward increased risk in vehicles newer than 2009. Upper extremity injuries continue to be the most prevalent injuries in newer model vehicles. Chief among these injuries are the injuries of the arm, forearm, hand, and wrist. Despite continuing prevalence, upper extremity injuries have historically received little attention in the automobile safety research community. Though they carry a lesser threat to life, upper extremity injuries have the potential to detrimentally affect long-term quality of life through persistent disability. The increased prevalence of hand and wrist injuries is particularly concerning because of persistent functional defects in this area can have drastic consequences on short and long-term occupational capabilities, as well as tasks in everyday life. All right, findings and conclusion. Newer model vehicles after 2009 carry less risk of injury. The largest reductions in injury risk were the lower extremities and risk of skull fracture. Between the model years, there was no risk in change of rib fracture or sternum injury. Females are at greater risk for injury compared to males. And injuries also remain common in the arm, hand, and wrist for all ages studied. So, questions?
Let's see. No, I don't think so.
Yeah, it's this nice article. Goes over. I really like the review of the females being more injurious, the older people getting injuries. So a lot of important concepts you deal with on a day-to-day basis in a case.
Yeah, no, definitely, because I definitely see significant with female drivers because most of the time they're driving with the seat closer to the steering wheel because Absolutely. They can't reach the pedals. So, you know.
Now, if they had my book, they would have known about those pedal extenders. You can clamp onto the pedals and make them longer so you can not be so up close against it.